Hello, I'm Angelina LACOMBE, and I'll be doing a physical assessment on a patient for NU361. I have already obtained my patient's history, and now I will notify him about the confidentiality agreement. Hello, patient. You have the right to confidentiality, which means anything that we do here is confidential. Also, you have the right to refuse anything that I'm doing or surpass anything, okay? So if you feel uncomfortable or feel any pain, please let me know.
Okay.
All right. So I'm going to perform hand hygiene and obtain gloves. I'm going to first start off and inspect the patient's face, noting any lesions, sores, or any abnormalities. Okay, patient looks great. And then I will palpate his cranium, noting any lumps, bumps, or any bruising or any tenderness. Feels good. Okay. And now temporal arteries. They're palpable but not bounding. And then now we'll move to the submandibular joints. All right, assessing for any masses or any irregular noises such as clicking. Can you open your jaw for me? Okay, perfect. None noted. All right, now I'm going to ask you to clench your jaw real tight. Let's see. Clench. All right, now I'm going to try to pull down. Don't let me. Okay, patient's jaw strength is great. Okay, now sir, if you could please smile for me. I'm going to check expressions. Can you frown for me? Can you close your eyes real tight? All right, can you blow your cheeks up like a chipmunk? Perfect. Okay, cranial nerve 7 is intact. Okay, and now I'm going to move to the eyes. We're going to check for cranials 3, 4, and 6. So we're going to check your extraocular motion and if you have accommodation. All right, so I'm going to shine a bright light in your eyes. All right, Prola is present. And now if you could please follow my pen line. All right, and now follow it again. All right, EOMI and Prola is present. Okay, I'm also noting the structure of the patient's eyes, the outside structure. They're symmetrical, equally distributed facial hair. See, and then we will also check his sclera and his cornea and conjunctiva. All right, sclera, there's no jaundice, and also for the conjunctiva, it is a nice appropriate pink color, no gray. At this time, I'm going to inspect the external ears, noting for any excessive hair growth or cerumen. Okay, looks great on that side. All right, no excessive hair growth there either, or lesions or any abnormalities. At this time, I'm going to do a whisper test on you to check out your cranial nerve 8, okay? So I'm going to whisper a word to you and you're going to repeat it to me, okay?
Okay. Banana.
Okay.
Go Cubs.
All right, go Cubs. All right, at this time, I'm going to check your sensation on your face. Let me know, close your eyes and let me know if you feel it.
Yep. Yep.
How does it feel? Soft?
Soft.
Or spiky?
Soft.
Okay, good deal. Okay, so at this time I'm going to inspect the nose, noting if it's symmetrical with the face, if there's any tenderness or anything like that. All right, and if I can ask you to cover one nostril and take a sniff. Can you do it on the other side? Okay, I was just notating the patency of your nose, and it sounds great. And now I'm going to palpate your maxillary sinuses and your frontal sinuses. Please let me know if you feel any tenderness. Any tenderness?
Nope.
All right. And now at this time I'm going to inspect your mouth. So I'm going to ask you to open wide. So as I'm inspecting, I'm noting the buccomucosa, that it's pink and moist, his tongue, no any abnormalities, of his hard or soft palate, the pharynx. Can you open your mouth and say ah?
Ah.
Alright, the uvula is midline and tonsils are present. I would rank it about a grade 1. Let's see. Okay, and now I'm going to palpate your cervical chain and checking out your lymph nodes. So let's see. Please let me know if there's any tenderness. Submental, submandibular, into your cervical chain. Any tenderness at all?
Nope.
Alright, good deal. So I'm going to check your range of motion of your neck. If you could please put your chin to chest. Good deal. How about bend your head back? Okay. Can you look to the left and the right? Any pain or tenderness that way? Alright. Can you shrug your shoulders? Alright. Cranial nerve 11 is intact. His trachea is midline. We're going to take a look at your thyroid. So this will be kind of weird. I'm going to follow through, go past the Adam's apple, thyroid cartilage. Alright, and if you could please swallow. Alright, swallow again. Alright, thyroid is intact and in the appropriate position. There was no deviation of my fingertips. And now I'm going to auscultate your carotid brewery. Okay. Alright, no abnormalities there. And now I'm going to palpate. Alright, carotid pulses are present and palpable, not bounding. No obvious signs of JVD, which is good. Okay, we're going to inspect the posterior chest wall. We're going to inspect, check, noting for any asymmetry, lesions, unequal hair distribution, chest is symmetrical, palpate for any masses or anything like that. Looks pretty symmetrical to me. Do you have any shortness of breath?
I don't.
Okay. I'm going to just note the chest rise and fall, so take a deep breath in. Okay, equal. And now we're going to auscultate the lung sounds. Every time you feel my stethoscope, take a deep breath in, okay?
Okay.
Alright, at this time I'd notate if there was any adventitious lung sounds or difficulty. There was none heard. Lung sounds clear bilaterally. Okay. If you could turn this way, we're going to check your range of motion with your arms. Okay? So can you extend your arms out, go up over your head, go back down, are you able to, yep, and adduction, okay, great. Active range of motion. We're going to check your range of motion of your elbow. So, you can do like a little robot for me. Okay, good deal. You're able to move it. We'll try your passive range of motion. Any pain or anything like that?
Nope.
Alright. Patient exhibits great passive range of motion. Palpate your arms, notating if there's any masses. Big muscles! Alright, and now I'm going to auscultate, I'm going to palpate for your pulses. Alright, radials present bilaterally. Let's go ulnar. Okay, present bilaterally. You can relax a little bit. And brachial pulses intact. Okay, now we're going to check your capillary refill. So you can hand me your hand. This is where I'll assess if it's alright. Good blood flow. It is brisk in less than 3 seconds. Let's see. with your hands. Are you able to extend? Alright, and now it's called supinate and pronate. So hold your hands open like bowls of soup and turn. Alright, patient is able to do that. So now we're going to inspect your chest, noting if there's any asymmetry, any lesions, scarring, masses, or anything like that. None noted. At this time, I'm going to listen to your upper lung sounds by. Right. Okay. Now listen to your heart tones. So just breathe normal, and I'll listen to you, okay? Okay, S1, S2 is present. Regular rhythm, regular rate. At this time, we're going to do an examination on the abdomen. We're going to first inspect, notating any abnormalities such as asymmetry, any masses, any pulsating areas. So far, it looks great. There are no scarring, no post-surgical scars or anything like that. Do you have any tenderness anywhere?
Nope.
No? Okay. When was your last bowel movement?
Yesterday.
Okay. Well, first I'm going to begin by listening to your tummy. So I'm going to oscillate all 4 quadrants. Okay. Bowel sounds are present in all 4 quadrants. They're normoactive. Okay. And now I'm going to palpate the abdomen. If you've experienced any tenderness at all, please let me know, okay? So I'll lightly palpate. Noting if there's any masses or tenderness. Okay, none noted. Now I'll go a deeper palpation. Okay. No rebound tenderness or voluntary guarding noted. After we do that, you can. So the abdomen's good. We're going to move over to the lower extremities. Okay. Good. Raise your leg up. So I'm going to palpate the popliteal pulses. As I'm doing this, I can also notate for any edema or anything like that. Dorsal pulses. Okay. You can relax. As I'm examining the legs, I'm noting if there are any abnormalities as well, any edema, any excessive varicose veins or anything like that. None is noted. I'm going to do your range of motion now, so if you could, can you lift your leg straight up? Okay.
Both of them?
Nope, you can do one at a time. Okay, now bend it down to your chest. Now up. Okay, back down. Same for this one. Okay, good deal. Alright. Did you experience any pain there?
Nope.
Okay. What about any pain here? Anything like that? Okay. So range of motion of the bilateral lower extremities check out to be okay. Now I'm going to assess the patient's musculoskeletal system. I'm going to ask him to, can you walk on your heels for me all the way down? And walk back on your heels. Okay. Now can you walk on your toes? Alright, we're going to do this thing called a Romberg test. So basically, you're going to stand right here, feet together, look forward. And at this time, I'm going to notate if there's any excessive swaying and his balance. Can you close your eyes for me and do the same thing? Alright, there's no excessive swaying that I can appreciate. At this time, we're going to check the cerebral function of you. So at first, I'm going to ask you to do the nose to fingertip test. So what you're going to do is touch your nose, touch my finger. Okay? With the same finger, okay? Ready? All right, that's good. And then can you hop on one foot? All right, and do the other one. All right, the patient has great balance. No real deficits there. Okay, and then at this time, I'm going to inspect the patient's spine. So if you could turn, face the back. Notating the curvature, if there's any abnormalities there. You could turn to the side and like bend over and touch your toes.
This side?
Yeah, either way. All right. Okay, you can stand up. And I'm notating if there's any kyphosis or lordosis or scoliosis. None that I can really appreciate. Now we're going to try and do your range of motion. So you were able to bend down fine. Can you bend to the side? Okay. The other side? Now are you able to bend back a little? Do you have any pain or anything like that?
No.
Okay. No pain noted. Can you turn your shoulders? All right. The patient has great range of motion. And now I'm just going to assess your gait. If you could just walk a little that way. Okay. And, okay, perfect. The gait was balanced. At this time, I'm going to have him do his visual acuity exam since this is a perfect distance. All right. If you could, please, can you just read without a cover, just read straight forward as far as you can go.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, C, D, D, E, F, P, O, T, E, C, L, E, F, O, D, F, C, T, F, D, P, L, T, C, E, G. That's as far as I can go.
Okay. Can you cover up your right eye and read as far as you can go?
E, F, P, T, O, C, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, G, D, P, C, T. That's about it.
Okay. So the left eye is 2015. Can you cover your left eye now and read it with your right eye?
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, G, D, P, C, T, F, D, P, L, T, G, E, D, maybe, possibly.
Okay. So right eye was 2015 as well. Bilaterally, without covered, he's 2010. Okay. Thank you for your time. Do you have any questions?
No?
All right. Thank you.